This is the AM Report. I'm Ayada Gajit, of course, with Michelle Craig. Now, here on the AM Report, we are focusing on COVID-19 by provinces by looking at how different departments are trying to flatten the curve.
Yeah, and the Northern Cape is one of two provinces, in fact, where the country has not recorded a single COVID-19 death. Now, that province currently has 30 confirmed cases, but opposition in the province have criticised the health department for not doing enough contact tracing.
Yeah, that's absolutely right. Now, that province has recorded its first case back in late March. For more on this now, joined via Skype by Mase Monopole, who's the MEC of Health in the Northern Cape. MEC, thanks very much for your time. Welcome to the AM Report. Perhaps we should start by, trying to explore why you think the Northern Cape in particular has been able to see as few cases as it has, in stark comparison at least to the other provinces.
Good morning, Ayanda, and good morning, Michelle. Thank you very much for this opportunity. As Northern Cape, perhaps maybe because of we are kind of peripheral in the economy of our country. So there might be that possibility, but what the work that we are doing of the screening, mass screen testing, is this the one that makes us to ensure that we pick up the cases and also education awareness in our people to ensure that they practice good hygiene, wash their hands, and as they cough, close their mouth. So those are the ones that we know that we have been very high on our education side. And the time of our people also in our province ensure that they adhere to the lockdown rules. Those are the things that help us to ensure that we flatten the curve.
MEC, the criticism of the Northern Cape and how it's conducting its testing, in fact it's being touted as an explanation for why the numbers are in fact so low, is that your province is not doing enough contact tracing, and so many cases are going unreported, and that really is the danger here.
I would still say that allegations are still untested and unscientific. We have done over about 722,000 screening, and as well as 2,805 testing. So you can clearly see that our screening is high. We could have, if the people who qualify to be tested, supposed to be tested. So those are the things that I'm saying that those are unscientific, saying that we are doing low because of our numbers of screening. It clearly shows that we are going out there and try to ensure that we test get the people who are a potential of being having the case, and then we take them and isolate them from our community.
But MEC, is that enough? You're saying 732,000 people have been screened. Now, we know screening, I mean, we're screened every day when we come into the building here at work, and all it is answering a few questions. Do you have a fever? Are you tired? And then your temperature is taken. But we know that for 2 weeks, when you are infected with COVID-19, you won't be showing any of those symptoms, but you will be spreading it around.
The epidemiologists have indicated our detection rate is on par on the formula that they are using. You can see that we have tested about 2,800 people, and we have 30 cases. It clearly shows that we are testing the right people, and those people who are tested, they are able to test positive. So the issue that the random testing, like I said, we have been on stage 4. The stage 4, we have known that you have to follow the issue of the protocol of testing. But now, because of the cases that are coming up now of late, they are rising. The cases of asymptomatic cases. Hence, we have to go ensure that we test in our hotspots. Hence, our numbers are going up because of hotspots to test hotspots.
So, MEC, the Northern Cape is home to many mining companies in the country, and already there have been a lot of questions asked about whether or not enough had been done to ensure that the miners that are returning back to work as part of level 4 of the lockdown regulations have been properly traced, screened, and possibly tested. Are you confident that that has been done adequately and doesn't pose additional risks to a health system that many have already questioned in the province?
I think 2 weeks ago, we had a meeting, and about a lengthy one, with the Anglo-American, which have 3 mines in our province. They outlined their plan of testing and screening, and as well as the measures they've put in place for those who have underground and open mine operations. And then the measures they're putting on site of saying the having isolation site and the quarantine site, should it happen that some of their workers, and over about that, they have procured mobile labs, and they're also going to allocate one for us to also to test the community, that is the surrounding community where they are mining. So the other mines which are there, about 7 of them, our national department has give us a report that there is some screening that is being done already. Those mines has done 9 tests, and all those tests that have been done are negative. But they are continuously screening all the workers as they come. Those are the measures that I think we have constant in contact with all the mines. We said to them they must be able to give us the stats on the daily stats of their screening and testing, so they can be able to monitor. And our National Department of Mining and Minerals and Energy has also said to us, saying they've given the guidelines. From time to time they will be doing some surprise visits, as well as we will join them to be doing those surprise visits. But the mines that they've been as their plans, I'm happy with the precautionary measures they've put in place.
MEC, let's talk for a moment about the state of readiness of health services in your province. You will have intimate knowledge of the challenges that exist in the Northern Cape, critical shortages of doctors, of nurses. Often there are no ambulances to deal with emergencies in your province. That issue, coupled with the fact that we know COVID-19 is such a stealthy virus, just in the way that it is spread around, tell us about your state of readiness now, should that number, and we pray it doesn't increase, but should it increase from 30?
Okay, I'll start first with our facilities. We have identified about 1,306 beds for quarantine, and for, we call it hospital beds. We have about 605 hospital beds across our province on 5 districts. So for the quarantine and hospital beds. But we are working also towards improving our hospital beds. Hence, we have continuously identified the sites to put up field hospitals in the areas that we think that we have identified as a potential hotspots, and the numbers that might rise that will need hospitalization over above the quarantine site. Coming to our workforce, I can say that our facilities there, those beds I've identified, I've mentioned, are easily available. Should it happen that we have those cases, we can be able to admit to those patients currently. We are working in collaboration with our private hospital in our province. The numbers of the beds I've mentioned are public and private, but majority of the beds are coming from the public hospitals. So we have appointed about 285 medical officers in our province and medical practitioners in our province. So those are the things that they have said we have been doing. Some of them started in April, others started now, other cohorts started now in May. We have appointed about 36 permanent doctors and 85 who are professional doctors. And then the nurses, about 168 nurses, and other categories of health, environmental health practitioners, the psychologists, those are the different categories that we have been appointed. So we are trying very hard to ensure that we put our system in place. We are continuously recruiting nurses and doctors to ensure that we prepare for the peak, because we are expecting the peak. In our province, the epidemiologist says that the peak will come around August and September in our province. So those are the measures I'm putting in place to ensure that but confidently now I can say, should it happen, if we need to admit 200 to 300 people, patients, we will be able to capacities there. We have trained our nurses, we have trained our doctors in preparation for case management in all our facilities.
So in spite of that, MEC, are we getting calls from several organizations, including the DA, for instance, who are suggesting that the Health MEC, Dr. Zweli Mkhize, should intervene because of the ways through which they perceive contact tracing is taking place there? I am interested, though, to find out what conversation is happening between the provincial government and the national government about the ways through which the Northern Cape is responding to the pandemic, taking into consideration that the MEC, at least on the face of it, is doing rounds across provinces in the country.
Well, thank you very much. I've made an appeal to the opposition party even last week. I'm still making an appeal even today. This is now not the right time and place for us to play into to the gallery. We have to work together to ensure that we fight this invisible enemy with regards to ensure that we put our heads together and support. We Sunday evening and up until the morning, our National Health Council, where all the MECs, we had a Zoom meeting with our MEC members, which is Ministerial Advisory Committee and other clinical committee members, giving us our presentation and an assessment of the work that we are doing in our province per province. And as the report is being given, each MEC has to account or be able to ensure. So there will be recommendations that we did. But with our reports, all the reports has been being presented. It shows that they are doing good, making good progress on the work that they are doing. All the measures are put in place, are visible and are being implemented too. That is the reason why. Because with us, there's no recommendation says the ministers must come and make an intervention. But the minister will be able to say to us, he is providing support to all the MECs in all the provinces. If he needs to come, he will come, but there's no need for him to come to make an intervention because there's no work that's been done. That is the reason why I'll say that I'm confident, and even the minister is confident on the work that we're doing in our province. So the issue is just wants to play into the gallery for them to be able to say there's an intervention. I can say to you now, we have 454 contacts that have been identified for these 30 cases that we have in our province. We can see that one patient does not have many numbers. There's the only 2 cases that has a big number of contacts. It was the first cases that we have in our province, those who were in contact with the Bloemfontein Church. One case, it had 115 contacts. But since then, all the contacts and the cases that we'll be having, the cases might have the minimum will have 1 or 2, but the highest was in our province. One case it had 115 contacts. So we are doing contact tracing. Even the newest case that you say, the reports, I'm getting daily reports on all the contacts that has been done on this. As I'm sitting here, I received the report yesterday of the latest case that was done and all the contacts has been done.
All right, let's leave it there at least for now. Thanks very much for your time. Certainly appreciate it. Mase Monopole is the Northern Cape's Health MEC.
And she's insisting that the province does actually have the COVID-19 outbreak under control. 30 confirmed cases there, no deaths as yet.
Yep.
They've been doing contact tracing, she says, and the 30 cases they're having just over 450 contacts who have all been traced.